suffer because of a thyroid disease, suffer crisis during surgery, especially no one's know what is premorbid. My immediate reaction to her was, are you still on chemotherapy for your bone marrow transplant? And then she told me, no, she's been she's been free of it with our non-Hodgkin's lymphoma for almost about 3 to 4 years. But let's go back to the disease process itself. What causes chickenpox? And when most of us can recognize that these are what the lesions look like when they start as maculopapular rashes, they appear. Sometimes you can actually, in fact, this woman was actually seen by the emergency room and diagnosed as an allergic reaction. It's very difficult for an allergic reaction to mimic chickenpox in the latter stages. But in the earlier stages, it can be anything from a folliculitis, which is an infection of a hair follicle. It can also be a small form of eczema. But when you get the vesicular lesions, all of us can make the diagnosis that is due to a herpes virus. And the most common herpes virus affecting the skin, presenting in these crops of macules and papules that then become vesicular, is chickenpox or herpes zoster. In the advanced stage, as it starts to get matured, they then loses the vesicular nature, and then they have these blackheads appearing on top of them, more necrotic than anything else. Most of us would probably recognize these as being chickenpox lesions that we commonly can see, but all of us will make the diagnosis at this advanced stage. But knowing fully well that it's not only chickenpox can present like this, other skin diseases can present like that, and we'll go into those later. What is it and how do you get chickenpox? You get chickenpox from somebody who's incubating. The incubation period is anywhere between 14 to 18 days. You get chickenpox from someone who has no lesions on the skin. It takes you from the time you get infected. And how do you get infected? You get infected from aerosol spread, meaning I've got chickenpox without any skin manifestation. I am coughing and I'm spreading the virus. I'm spreading the chickenpox virus, the herpes virus, by aerosol spread. You can get it, but rarely so, from the fluid that comes from the vesicles. But more commonly, it's the aerosol spread. What happens then that I get it from the person who doesn't even have a lesion yet, because that's the incubation period it takes the virus to go from stage of inhalation of the virus. It then spreads through the lungs into the blood. When the virus replicates and form more viruses within our bloodstream, then we start to get the fevers and chill. We feel fevers, chill. It then migrates into the bone. You get bone pain. You feel the most wretched you have felt in all your life because the pains are excruciating. You've got fevers and chills. You can't do anything. Then, lo and behold, the next morning you wake up, you see lesions, these red lesions that appear on your face and sometimes in your chest wall, first of all. You see them, you start to squeeze them. As you squeeze them, those are the ones that will leave permanent marks on your face. If you leave them for 24 hours to 48 hours, you will start to see that these red macules and papules become vesicular. Then they start to fill with fluid. Then your grandmother will tell you that you have chickenpox and go to the doctor. The treatment at the time when you suspect you're exposed to someone with chickenpox or not even knowing what it is, but you have the severe fevers and chill, those are not associated with any of the other conditions, folliculitis, the eczemas that present. So you know that you have some herpetic infection, at least, that you should be seen for. Why is it that you should be seen early? If you start treatment with an antiviral treatment, you can actually prevent the number of papules that form on your skin. Because as it multiplies in the blood, the virus itself just localizes in the skin itself. In some cases, which can be fatal, the virus itself can spread to the lungs itself and even to the brain. If you drink aspirin when you have chickenpox, you can also get Rice syndrome, which can give you hepatitis, which can lead to hepatic failure. The treatment of choice, yes, you can eat any meat or any fish you possibly want to eat. There's nothing that says with chickenpox you cannot eat that. Obviously, you have no appetite. All you want to do is drink. You could take any antipyretic cream and rub it on the skin, Aveeno baths, etc., to alleviate the itching. But anything like Benadryl or hydroxyzine will alleviate the itching. For the pains, obviously, we'll take things like Tylenol every 4 to 6 hours. And depending on the amount of lesions that appear, especially in a young adult who doesn't want to leave many scars on the face, or any person at all, we can go on an antiviral medication. But the education part of it is that long before you actually see the lesions, you're already spreading the disease. And to be very careful to come into contact with anyone who's immunocompromised, because them, when getting chickenpox, can be life-threatening. In a child, it's better if they're exposed to it at that stage when you have the disease, because that will prevent them from getting it as an adult. We continue the discussion to do with some of the common skin conditions that I see in my medical practice. We alluded to chickenpox. Some people think that after you have had chickenpox, then it's all gone. You will never have another episode of chickenpox unless you become immunocompromised. But what happens in quite a few cases is that the herpes zoster remains dormant in the nerves. And a lot of times you will get recurrence of or recrudescence of the virus growing within the nerve ending. And possibly the most dangerous one is to have invasion of the ophthalmic nerve. And that can actually cause blindness. You see these vesicles as they arise from the side and advance all the way towards the eye. It is extremely painful when it involves the eye, and it should be treated rapidly with antiviral medication, liberal analgesics, and the treatment has to be started early. A lot of times, I think about 4 months ago, I saw a patient with post-herpetic neuralgia, extreme excruciating pain involving the thoracic cage. In fact, the herpes virus has actually invaded the nerve, the intercostal nerve, and actually started vesicles. But it was such a classic description of the lesion with the vesicles, the redness, the inflammation around it, that the diagnosis was very simple. But yet he had gone to 3 or 4 doctors and had actually shown the lesion to them, explaining the amount of pain he was having, and it was never dealt with. But these lesions need to be dealt with extremely rapidly, because they advance, and the more they invade the nerve, the more painful it is to the patient, and the longer the duration of the illness thereof. So the herpes virus, the chickenpox in itself, is not just an innocuous skin disease. At the time it happens, yes, but it can also give complications to involve a meningitis. It could also cause a pneumonia, which can be fatal, but it also can cause liver failure. And as a sequelae of it in later years, it can also form these herpetic lesions, which can recur as time goes by. So invasion of a nerve at one time can cause blindness, but then recurrence of it is the worst part to deal with. In addition to that is that exposing a person to a herpes, to a chickenpox, when they're immunocompromised, can also be fatal, especially in HIV patients, patients with Hodgkin's lymphoma. In fact, patients with Hodgkin's lymphoma, which in this particular case was the patient who presented to me, was brought by a relative who had Hodgkin's lymphoma. And if the patient with Hodgkin's lymphoma gets the chickenpox infection, that could be fatal for that person. HIV patients, when they actually have chickenpox infection, are treated as being very serious cases within the hospital. Leaving chickenpox behind, one of the most common conditions I see as you walk down Liberty Avenue is especially Indian women, women of Indian descent, having from the Caribbean islands or elsewhere, having this mask-like brownness or discoloration around the face, which is called melasma. Sometimes it makes the face look dark, but it also makes them feel very, very, very aware of what they have on their face. And it's something that's easily treated. But one of the biggest misnomer about the misunderstanding about it is that exposure to sun does not cause exacerbation. Yes, it does. It increases the sensitivity, hypersensitivity of that area that's affected. In fact, this is how melasma will present with a darkening of the face in a Caucasian person. In our people, it presents with the same darkening over the face itself, but it gives a mask-like appearance. Here we should be using things like sunblocks, and bleaching creams will get rid of it, at least temporary, or decrease the discolorations, because when it occurs in a fair person, the darkness is extremely prominent, and I've known women in my practice who are extremely sensitive about the facial appearance, especially with melasma. It is not indicative of any underlying disease. Compare this, however, with something called discoid lupus, much more common in the Afro-Caribbean population, that's associated with systemic lupus erythematosus. You have this butterfly lesion that is hypersensitive. When you go into the sun, it looks like a butterfly over the face. All right, but it's a very sinister disease. Systemic lupus is associated with multisystemic organ failures. It can cause, from a head-to-toe approach, it can cause alopecia or losing hair. It can cause lesions within the mouth. It can result in generalized aches and pains. It can cause a pneumonitis. It can also cause, but the most important problem that it causes is premature renal failure. The discoloration of the face might be the reason why the patient comes to the doctor and present with a butterfly rash in the face and saying it gets worse in sunlight. You question them even further, you might find out that they have also, in addition to that, generalized aches and pains. But to your surprise, when you do a kidney test on them, just a simple blood test for the kidneys, you might find evidence of early kidney disease. Systemic lupus erythematosus even is not considered a common disease over here. In the Caribbean, in our Afro-Caribbean population, it is a very common disease. And the basic thing about it, there's no cure for systemic lupus, but you can treat the symptoms early. You can address the issue early with the patient so they can monitor, especially the kidney function. You can also have the cardiopulmonary system evaluated, because systemic lupus can actually cause death if left untreated. But the morbidity associated with the multisystemic disorder can result in a lifestyle that is less than accommodating. Our discussion today will center around allergies, allergic reaction, sinusitis, and bronchitis. Lots of times patients confuse the words allergies and I'm allergic to. At all times we should be extremely clear in our minds, especially if you're allergic to a particular medication, especially penicillin. Because a lot of times these medications can be given in the emergency room and sometime in a comatose state, if it's given to you, especially if you're allergic to it, can result in death itself. It's very simple for us to just be aware of it, but it's always nice to have a bracelet that says I'm allergic to whatever it is, because that's one of the first places we will check in the case of an emergency. An allergic reaction is life-threatening. But the most common presentation of allergic reaction, as we all know, is this macular and maculopapular rash that appears on the skin like wheals all over that tend to itch. And we scratch them to get rid of the irritation they produce. And we all can get generalized itching all over, even get Nikolsky phenomena. You scratch and you see your wheals appear over the area you scratch. But the skin manifestation itself is easily treated. And usually something like Benadryl or hydroxyzine will get rid of it, but you need to find out what you're allergic to. Could it be something that you rubbed on your skin, or could it be something that you've eaten or you've ingested in some other form? Those are the two most common methods of getting an allergic reaction. But your cells regard that whatever it is that you are exposed to, whether it's from the surface of the skin or ingested and into the bloodstream and then went to the skin, as being something that you cannot take. And the mast cells are the ones that produce this fluid and the irritation around the skin. But what it does to the lungs itself is cause the same mucosal swelling that can result in asphyxia. You will not be able to breathe. And a lot of deaths have been associated with the use of penicillin in the past, when epinephrine was not given at that time as a life-saving procedure. that basically people will die from asphyxia, not because the airways themselves just clamp down and you're unable to get air into the lungs. So it's extremely important that anything you're allergic to, you tell your doctor about this, but the rest of the family should be made aware, and so you should also have a bracelet that says to the public that you're allergic to X, Y, and Z. Allergies, on the other hand, is what we all develop at this time of the year, and sometimes a lot of physicians, thank God for